Welcome to today's edition of Mental Health Matters. Today I have Dr. Ryan on the show. She's going to talk about the LGBTQ community health and mental health. Get you something to drink and get you a snack and come on back. All right, Dr. Ryan, welcome to our show. How you doing this morning?
I'm doing very well. Thanks. It's great to be on the show.
Thank you. And I do appreciate you taking the time out on this Sunday morning and just kind of talking to us a little bit about the LGBTQ community regarding health and mental health. I think this is a very needed educational moment for the community. So why don't we start by you telling us a little bit about who you are and just some of the work you've done.
Sure. Well, I'm a clinical social worker and I'm a researcher. And this is my 45th year doing work in LGBTQ health and mental health. I started this work in the 1970s and I helped organize the early, what then today we would call the LGBTQ health movement. And that included developing resources and convening national conferences, among the first conferences on LGBTQ health and the first AIDS forum. I worked in the early AIDS epidemic. In fact, I was set to do my clinical training in Georgia, in Atlanta, at the very beginning of the AIDS epidemic in 1980. And I saw it emerge. The community had a huge population. It was the center, really, of queer life in the South. Yeah. And so many young LGBT people would leave their homes and go to the large cities to try to live more integrated lives without shaming their families. And so it was the population then in Atlanta of LGBT people was about 250,000. Wow. There were many bars. There was nightlife. The drag scene was huge. I think maybe even one of the centers. And there was a very vibrant energy. And then, of course, AIDS impacted everything. And I got involved early on. I became the director of the first AIDS organization in the South, Aid Atlanta. I worked with young gay and bisexual men who had left their communities to come to the big city. Yeah. And when they were, what happened then with AIDS, that people died in a very short period of time. And so in addition to doing a lot of prevention work and putting services in place, I would meet their families when they would come from these small cities and towns across the South. And so I saw something very different. The perception has always been that families are incapable of supporting their LGBT young people and that families were part of the problem, especially back then. And in my work, I would meet those families and bring them to the bedsides of their dying children. And so I saw their devastation. I saw that so many of them would have done anything to change the future, but it was impossible. And that had a big impact on me. I don't know if many people in the community realize that from the very beginning, young people of color were part of those diagnosed with AIDS. In fact, at the very beginning, at least 39% of gay and bisexual men were people of color, predominantly African American. And so I saw a really diverse range of lived experiences. And that had a huge impact on me in many ways. And at that point, I realized that I needed to do something to make a difference. And I knew that the most important thing that we could do was to develop a way that families could get accurate information and that they could learn to support their LGBTQ children in the context of their cultural worlds. And my work has always been about culture. I've always been fascinated by it. I was an organizer back in the 1960s when I was a teenager in the social movements. I've been really struck by how powerful culture is. And I knew if we could find a way to engage families in the context of their cultures and their faith traditions, that we could have a way to help them learn to support their LGBTQ children, even if they thought that being gay or transgender is wrong, which many still do. So it wasn't until years later, when I moved to California 21 years ago, that I had an opportunity to start that work. And my plan was to not only do the first research on LGBTQ young people and their families, but really to use that information to develop the first family-based support model to prevent these serious health risks and promote well-being. So that's what I began 21
Wow.
years ago.
That is quite an impressive resume. I was reading over your bio and just some of the material you sent. I noticed that you have some in for the Asian community, and I think it's very impressive. Um, why do you feel you had there was a need for what you brought to the LGBT community? Like, what made you like go full throttle and just become this strong advocate for the community?
Well, I think growing up, being a teenager in the 1960s, it marked us, especially if you were part of those social movements.
Yeah.
Civil rights movement, the women's movement, the emerging lesbian and gay movement. It was a remarkable time. And I knew from a very early age that I would do social change work. I didn't really know what it was until I really understood who I was.
Yeah.
And it just made perfect sense. And I think the other thing that really struck me was that there were so few resources when I started doing this work, and that even just stepping up and beginning to put resources in place could make a difference. One of the things I did was to start the first national directory of, back then, what we called lesbian and gay health services. There was nothing like that would help connect providers across the US. That network of providers then became a network to deal with AIDS and lesbian health needs and all of the other kinds of health issues that would then come later on. I don't know that I had a sense that I was really going to change the world. I just really wanted to make a difference. And I think back then, so many young people were struck by the opportunity to engage in action and civil action and social change work. And it just really became my mission.
Wow. Very, very, very nice. Man, this, I mean, we can, it's just you got a lot of information to share. And I'm really just fascinated by everything you have done thus far. I want to actually, I noticed when I was reading the material you gave me, it seems like you focus a lot on the children and adolescents. Why is that? Why that particular age group?
Well, we've always known that what we now call LGBTQ youth had high health risks. And since research was first done on gay men and then lesbians and then bisexual adults, it focused on risks because risks were just so widespread. In
Yes.
particular, mental health risks, and then certainly sexually transmitted infections and sexual health risks and HIV and just mental health needs in general. And all of the research from very early on with adults showed high levels of risk for suicidal behaviors and depression, substance abuse, and so on. And as research started to be done with adolescents, with gay adolescents in the late 1970s, it showed the same health risks. And so it was really clear that unless we provided support early on, that those health risks would continue across the life course. So, plus, I think as an adolescent myself who'd been struggling, I, early on knew that I wanted to do something to make a difference. And it really made perfect sense to start with adolescents. In fact, when I started the Family Acceptance Project, I knew that we needed to work with children too, because I saw that children were self-identifying as gay or whatever language they would use. And I also saw, because I had worked in the field for so long, the emergence of the personal computer had such an impact. And
Yes.
queer people are early adopters, the access to computers, access to online support. You could be
Yeah.
anonymous, you could connect with others without having to out yourself. That's something that's always been a part of our lives. And the impact of the internet and increasingly positive images of queer people that gave young people a sense of the future, that all of a sudden they could see sports stars and celebrities and doctors and pastors and people with families and people being elected to public office. And it really changed the perception of who queer people are and were. It had been so steeped in deficit and deviance. And it was really hard for many people to identify with that. But once we began to see positive images of ourselves, young people could begin to see into the future. And I knew it was going to be incredibly important, because when I started FAP, the Family Acceptance Project, soon before that, there had been important research that showed that families make a great difference for adolescents in general, for providing support, helping reduce risk. And yet no one had ever studied the families of LGBT youth. And so what I knew was that we needed good research, we needed comprehensive research, and we needed to look in through the lens of culture to understand how these social forces impacted people's lives. So I wanted to start with, with a very comprehensive, rigorous study. And my partner in doing this work was Dr. Rafael Diaz, who did the early research on gay and bisexual men and HIV mental health. He developed a whole sociocultural model of risk to show how culture impacted risk behaviors and prevention behaviors. And so we brought a different lens to it. And in fact, when we started this work, we did all of it bilingually, biculturally, in English and Spanish. And since we were in California, there was a large Latino population to draw from that we could, connect with. And we could find enough adolescents who identified as LGBT, even back then, because the population was large enough, which was not the case necessarily someplace else.
Yeah. Wow. So tell me, what is the Family Acceptance Project? Well, let's talk a little bit about that.
Um, what I wanted to do was to not only do comprehensive research, but also to develop the first family support model that would enable these diverse families to learn to support their LGBTQ young people, and to do that in the context of their cultural worlds and their faith traditions. So I think it would help if I showed you some slides.
Yes,
So
absolutely.
let me do that right now.
Okay.
So the Family Acceptance Project isn't just a research study. In fact, it's a series of linked research studies that focus on increasing family support and decreasing risk. And it also includes education and training, really changing how providers and the public access information about helping families increase support, a family-based model, an evidence-based family model. When we started this project, even back then, there was a high proportion of out-of-home LGBT youth. And the perception back then was that when conflict was in the home, when conflict had erupted, the sense was, well, there's really nothing we can do about it. We have to remove these young people from their homes. So going back early on, we had a significant level of LGBT people in the foster care system who were homeless, who were street youth, who were in the juvenile justice system. And we really needed a way to develop informed public policy showing that these are programs and services and prevention and activities that are really needed to prevent removal from the home, but also prevent the serious health and mental health risks that LGBTQ young people experience. And so we started this project by doing a very comprehensive, in-depth interview study called a qualitative study, where we studied LGBTQ young people and their families who were accepting, ambivalent, and rejecting of those LGBT young people. And each interview was 2 to 4 hours long, and they were individual in English and Spanish, and did this work all over the state in urban, rural, suburban, farm worker communities, rural areas, coastal villages. And our team would go and we would study individually the adolescent and other key family members at the same time. So we would generally, it would take a day, and those hours were those interviews were 2 to 4 hours long in English and Spanish. And we ended up with thousands of pages of transcripts. And we learned a great deal about their lives, about sources of support, victimization, who was in their family constellation, how the family responded to that LGBTQ young person. And in fact, we identified over 100 specific behaviors that parents and caregivers used to respond to that LGBTQ young person. Behaviors like preventing them from having an LGBTQ friend, or excluding them from family events and activities because of who they are, versus accepting and affirming behaviors like finding a positive role model to give them a sense of the future, or talking with religious leaders to help the congregation become more supportive, to be supportive of those LGBTQ family members. So we took all of those behaviors and measured them, and we were able then to show how these accepting and rejecting behaviors affect risk and well-being, how they contribute to risk and well-being in young adulthood. And then we took all of that information back to a very diverse group of LGBTQ young people and their families. And we did this work not only in California, but also in other parts of the US. We did it in several different languages with families and youth from all different kinds of backgrounds, where they would teach us what our findings meant to them, how to talk about them, how to present them, how to share them, what that information should look like, to help share it with people from their cultural worlds, to help those families reduce these rejecting behaviors and increase support. And we developed a family support model to help diverse families learn to support their LGBTQ children, that could be implemented in all kinds of settings, in behavioral health, in school-based care, in out-of-home care, in pastoral care. And we've been implementing that model in different kinds of settings. And we're always looking for partners, especially here in California, to do that work. These are some of the more than 50 family rejecting behaviors that we identified and measured. Blaming your child when others mistreat them because of who they are. It's their fault because of how they look, how they act, because they told people about who they are. Using religion to condemn, deny, or minimize. Silence and secrecy, ridicule, preventing them from learning about their identity or having an LGBTQ friend, or getting the critical support that young people need to learn about who they are and learn to affirm their identities. And then we also identified more than 50 family accepting behaviors, like supporting your child's gender expression, standing up for them when others mistreat them because of who they are, self-educating, getting accurate education and information about sexual orientation and gender identity, and several behaviors that parents and caregivers can do even when they believe that being gay or transgender is wrong. Behaviors like requiring that other family members treat your child with respect because they're a member of the family. Just simply sitting and talking with them and listening respectfully without interrupting or punishing them or ridiculing them, to understand what their experiences are like. So we took all of these behaviors and we measured them to show how did they contribute. How does the presence or frequency of these behaviors contribute to health risks and also to well-being in young adulthood? And we showed that the more behaviors of these rejecting behaviors that young people experienced, the higher the level of risk. So here what you're seeing are LGBT youth from families that were highly rejecting, ambivalent, and really not rejecting. And so with a lot of these rejecting experiences during adolescence as a young adult, they're about 6 times as likely to report high levels of clinical depression and much higher levels of illegal drug use or putting oneself at risk for HIV through risky sexual behaviors. And then, of course, suicide attempts with a lot of those rejecting behaviors, a more than 8 times greater likelihood of attempted suicide, cut, remarkably 3/4 by moderate levels of these rejecting behaviors. So you can see that as these rejecting behaviors increase, so too does the level of risk for those young people. And this was pretty shocking for families to see, because so many families that are engaging in these rejecting behaviors that we just talked about think that these will help their children have a good life, fit in, be accepted by others, keep their family together. But this is what some of these rejecting behaviors feel like to young people. We're working now on a communications campaign. Well, these will be social media memes that we'll disseminate. We've been working on this campaign in Oregon, and now we're going to be doing a national campaign. And this is what it feels like to a young person, not letting them participate in LGBTQ events. And this is one of these common family reactions to try to protect their child, but that actually significantly increase that LGBTQ young person. These are behaviors that many people wouldn't think of, but these came right out of our research, and we've seen them replicated across the US in other countries I've worked in. Many countries outside the US, a lot of the Spanish-speaking countries, China and elsewhere, silence and secrecy is so common. And young people who experience invisibility because no one ever talks about who they are. It's never discussed. It's almost like they don't exist. We found that as young people are raised in families that are supportive and affirming, they believe that they can have a good life, that they can be a happy adult, which impacts their having a sense of the future and self-care, using a condom, using a seatbelt, having a rich social support network around them to be there for them, when they need it. We saw that as these family supportive and affirming behaviors increase, so too does the level of well-being. Young people from highly accepting families, their overall health is so much better. They're much less likely to be depressed or to think about or attempt suicide or have substance abuse problems. They have better family relationships and much more social support. And this is what that feels like. This is a parent imaging all of the positive social milestones and personal milestones that her LGBTQ child can have. Graduation, affirming their gender identity, being a parent themselves, having a rich, satisfying interpersonal relationship. This is so important. If your parent believes that you can have a happy future, they will be there for you to participate in that future and help affirm you all the way along. Using your child's chosen name and pronouns, these are so important to affirm a young person's sense of who they are. Our colleague Stephen Russell, who worked on some of our research, showed in a study that when transgender and gender diverse young people could use their chosen name in the widest possible places and with their family, with their friends, at school and at work, it could significantly decrease depression and suicide attempts. It's so important, a small step that really makes a big difference. So one of the things I think that people need to understand is that all of these rejecting behaviors focus on trying to change, prevent, deny, or minimize a child's LGBTQ identity and gender diversity. We hear a lot in our community that taking a child to a therapist or a religious leader to change them is the major rejecting behavior, but it's really just one of 50 family rejecting behaviors that parents and caregivers use to respond to their child's identity when a minor goes to a therapist or a religious leader to try to change them. The parents are the gatekeepers. They take them outside the home to change them. But they're also engaging in family rejecting behaviors at home. And those family rejecting behaviors are ongoing, and they can happen everywhere. They can happen 24/7 in a rejecting home. And if we think about the pandemic, where so many LGBTQ young people were isolated and confined with their families, think about for a moment being confined with a rejecting family, where these negative messages, these more than 50 behaviors that we identified and measured are being repeated daily, even more often. The tragedy really is that most parents don't know that these behaviors are harmful. And so it becomes so incredibly important that we educate everyone about these accepting and rejecting behaviors and the impact that they have on LGBTQ young people. Because parents so often see these behaviors, family rejecting behaviors, as a way of helping their child, teaching them to be a morally correct person, helping them care for themselves, protecting them from harm. And we found that parents are typically shocked to learn that these rejecting behaviors that we've identified that they think are helping are actually hurting their child. So it's really important to give young people messages that are hopeful and helpful, and to teach parents about these behaviors. We found that just by reading our resource materials, our family education booklets, learning about our work, seeing our Healthy Futures posters, many parents and caregivers can change those behaviors quickly. Some change their behaviors even overnight. And also receiving our family support services. We've helped many families and caregivers learn to change those rejecting behaviors and support and affirm their children. It's really remarkable what happens once families get accurate information in a culturally affirming, non-judgmental way. These are some of the ways that we teach about this work. We do training. We do training in California with some of the counties and across the US and in other countries. We have family education booklets that are best practice resources for suicide prevention in different languages, our Healthy Futures posters, and family education videos. So for example, our family education booklets, we've disseminated over 600,000 copies of these in 70 countries. They're on our website. Every day, people download between 20 and 40 copies of our booklets and our Healthy Futures posters. These have images that show, the impact of risk, a list of behaviors, and more information, background information to help families learn to support their LGBT kids. We've also been developing a faith-based series, and I always need funding for this because it takes a lot of time and resources, but it's incredibly important because faith is a culture too, to help families understand how to support that LGBTQ child and reduce these serious health risks in the context of their religious values. And our Healthy Futures posters, where we have 4 different sizes that give a little information about the fact that this is evidence-based, that list 20 to 21 different accepting or rejecting behaviors with an infographic that shows how these behaviors relate to risk and well-being. And we even have a conservative acceptance version that doesn't talk about dating, which is a doorstopper for many conservative families. But these posters should be in all settings everywhere. They should be in every public setting. They should be in all settings where children, youth, and families are served, in schools and congregations and our community centers and in pediatricians' offices. They're on our website and anyone can download them. We have them available in 4 sizes for free in 10 languages. And I really hope that anyone who's listening today will go to our website, download the camera ready art, take it to their commercial printer and get these printed. We have them starting at 8.5 by 11 sizes that a parent can give to a grandparent, post it on the refrigerator, hang these in their homes, because we're talking about behavioral change, and that takes a while for people to learn to change rejecting behaviors. We've also done, and to increase affirming behaviors, which is so incredibly important to give LGBTQ young people hope. We've also been developing a family video series that show how families move from struggle to support. This is our website. I hope that as a result of our broadcast that folks will visit it and learn more about this work.
Very, 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 very impressive. Wow, this was really good. I honestly, I didn't think you was gonna showcase it like that, but it was really good. I want to ask you a question. The affecting behaviors. I know you talked a little bit about it, but do you feel like a lot of the family members are being selfish when it comes to rejecting the family member for their sexual preferences, for lack of better terms? Because I know that just on a different subject, I've been friends with people who comes from a very strong core value system, and if the behavior do not line up with the culture or what they've been taught or how they've been raised, the family try and come in and alter that particular behavior, and then they will eventually start to reject the individual because they're not doing it the way that they feel like they should be doing it. Do you feel like that's a little bit of truth, what you're saying as well?
Well, I think it's a question of two very different perspectives. So one of the
Yeah,
things we've done is because I've worked with thousands of LGBTQ young people now, and I don't even know how many families over time, and from
yeah,
all different kinds of cultural backgrounds. And typically, parents love those kids.
right.
Families love those kids. They're connected
Yeah,
to them. They want them to have a good life. They want people to respect them. They want them to be happy and healthy most of all.
yeah,
And really, we've had now generations of misinformation and disinformation about sexual orientation, and misinformation about gender identity and gender ideologies that really force people into dressing, looking, interacting, behaving in certain kinds of ways. So the parent's perspective is one of um, pressuring that child to fit in, and it
right.
is the default position to pressure that child to fit in. And it's the default position to engage in those behaviors that the parent thinks are helping, or the auntie or grandparent or whoever it is who's raising that child. But that young person experiences as rejection and is really hurtful. And then our objective research has now shown, connects those behaviors to serious health risks in young adulthood. It's like we can show those parents a picture of the future for that child. And the
Yeah,
future may mean that their child feels so distressed and hopeless because they've experienced these rejecting behaviors, and maybe they've been bullied, at school or by peers, and had other rejecting experiences. They feel so bad that they take their lives, which is a
yeah,
tragedy. And once we can show parents and caregivers objective research, and we use pictures a lot to tell the story of what we found, because it makes it very understandable for people who don't necessarily know about research. They're shocked. I've seen
yes,
parents break down in tears and sob because they know their child has already attempted suicide at least once. They know that they've become very withdrawn. They know that they're depressed. They know that they're using drugs. They know all kinds of other things about their behaviors that have been really troubling, but now they can begin to put it in context. And also, we can give them a way to do this that doesn't require them to change their beliefs. We work in terms of the family's values. So when we work with a parent or caregiver, we learn a great deal about their background, their cultural values and beliefs, their religious values and beliefs. Do they know, what they consider to be happy, healthy, well-adjusted LGBTQ people? Many of them don't. And so they have these very negative, distorted images of who queer people are and who they can become. And you have to have patience. LGBT young people, queer young people, have often been thinking about their identities for a really long time. And by the time parents find out about it, many of them, to them, it seems very sudden. And so they need time and they need support. And most of all, they need accurate information. So we do this and we provide this in the context of their cultural world. And it makes a huge difference.
Yeah. Years ago, my nephew came out per se, and he had a mentor, and how this conversation came about. We knew who the mentor was. We knew that he was kind of guiding him with, education, and so the mentor invited my sister and her husband to a dinner, and he said, there's something that um, Cortez going to talk to you about. And so my sister, she was unable to attend, but my brother-in-law went. And when my brother-in-law walked in, my nephew was very fearful. This is what I was told, according to my sister. My nephew was very fearful, and immediately my brother-in-law knew something was not quite right in terms of how he was behaving. Like he didn't understand. And so it took about 30 minutes for the mentor to tell my brother-in-law, because they was still trying to reach out to my sister and wanted my sister to be part of this conversation. And so finally, when she couldn't get off work, whatever, they told. And so, of course, it was a shock factor to my brother-in-law, because nobody, nobody knew. He act like a straight male.
Mhm.
You just wouldn't know. And so when my sister found out about it, I was the first person she called. She was crying, and she was like, "Oh, I don't, want them to stop wearing a dress, and like, people gonna hurt him on the block, and just all type of stuff." And so I told her, I said, "Well, let me call him." I said, "Let me call my nephew, and I'll call you back." Because she was like very irate, like she was like really crying profusely. Just, she didn't, she was really shocked behind it. So I called my nephew. You asked him a series of questions. The good thing about it, since I worked at Cal Voices, I kind of know partially the work she does, and just being in the mental health field. So I asked him a series of questions, just kind of like asked him how he felt when it happened, and like how long have you been in the closet, and just different things. And he started to tell me a lot. My heart broke, because I'm like, man, like all these years you dealt with depression. He told me he had suicidal ideation, like all type of stuff. And I felt bad for him. He was ashamed to go home. And so what I told him, I said, well, see if you can go over a friend's house and stay a couple of days, and let this kind of sit with your parents, because it's a shock to them. They need to, get their own thoughts together. And I told him, I said, nothing wrong with you. You have done anything wrong. And I just reassured him that, which later on I found out, he said, because he called me Uncle Jesse, he said that conversation really, really helped me, And so then after I got the phone with him, I called my sister back, and I just got to talking to it, calmed her down. I told her, I said, it's going to be okay, Regina. I said, this is his life. These are his choices. He no longer live in your house per se, because he was in school at the time, standing in the dorm. But, he would come stay on the weekend. And so once I kind of talked to both of them apart, then I kind of talk to him and say, well, why don't you meet with your mom and dad outside the house? Because there are other siblings there, because she didn't want nobody else to know. It was hard for him. And I felt bad for him, because all those years he suffered in silence. And even today, nobody talks about it in my family. Like, he doesn't identify with being gay. It just a few people know, like a very small percentage of other family members know, because of the stigma that's attached, And here and there, I'll throw some out there, have a conversation with him, he'll start laughing, and then because how we want to know, because he's so hush hush about it. But it's just unfortunately that people do have to live in shadows like that, and don't live in their truth per se.
Well, that's actually, unfortunately, a common experience for many LGBTQ young people. In fact, um, I've found many young people who were afraid to come out and really feared the worst.
Mm-hmm.
And then when they came out, their parents accepted them. And so they spent so long, or so many years, really suffering in silence and being depressed, and maybe
Mm-hmm.
having suicidal thoughts, because they just felt a lack of hopefulness. I think one of the things I would recommend is that you share our posters with your family and
Hmm.
how important they can be in promoting well-being for your nephew and helping him integrate his identity and be proud of who he is and help boost his self-esteem and self-worth. There are so many things that you'll see from our research um, that parents and caregivers can do to help protect their child against harm and promote their well-being. And that's actually the reason why I'm trying so hard to get these posters out into public spaces. We hear all the time about adverse childhood experiences and how these early experiences in life impact risk in later life. The challenge with that is that ACEs don't ask about sexual orientation and gender identity and the specific family rejecting behaviors that we've identified and measured. Those behaviors predict health risks for LGBTQ young people, like suicidal behaviors and depression and substance abuse and risky sexual behaviors. We have a way to screen for that uh, because LGBT young people are at such high risk because of stigma, lack of support, victimization outside the home, risk from other people. And we see risk increasing now, certainly during the pandemic, when there's just a lot of generalized anger and distress.
Yeah.
And for LGBTQ young people who've been isolated, their risk is even higher. So it's so incredibly important to get these behaviors out in all spaces where people can see them, because we
Yeah.
know that a lot of people can change, families, caregivers, others can change their behaviors once they understand how they're affecting LGBTQ young people. And I would hope that one outcome of our show would be that anybody who's listening, if they're an agency director, if they're a provider, if they're a pastor, if they work in a homeless shelter, that they get these posters, they download them for free, take them to a printer. They range in size from a small handout all the way up to a wall-size poster. We have to make sure that everyone understands that you can make a profound difference
Hmm.
just by changing your behavior. And it
Yeah.
doesn't have to be everything, just a little bit of change makes a difference.
I think that some family members feel like if they accept their loved one sexual identity, I think that they feel like they are enabling them. I had to really work with my sister on that. And I had to tell, I said, well, no, you are loving your child for the person that he chooses to be. I said, if he became adopted, would you not love him? Or if he became a lawyer, would you not love him? And I had to explain to her, would you rather see your child dead in a grave, or would you prefer for him to live in his truth? And it took a lot. It took a lot because the way my family is, the dynamics, it just took a lot. Now she's definitely, even though that we don't or they don't talk about it per se, sh but she's definitely accepting more so now. I think that it's definitely has. I think she's even talked to some of her coworkers who kids have came out and things like that, and she shared her own experience about how she felt in her initial response and things like that. But I do think that by it not being talked about in my family, I do think it's kind of, it's not really helping the situation per se, because I feel like you're gonna love somebody, you're gonna love them and accept them regardless of what choices they make. But also I feel like my brother-in-law is a little bit selfish, because he's one of those who's a man's man, and he's very prideful and his image and things like that. And so, it's just going to, like you said, it's going to take a lot of work and education. But, it did really bother me when my nephew was telling me he thought about committing suicide and just, man, I just like, man, you just never know what a person's going through. So,
Well, that's exactly the case. And that's why even showing support, even when parents don't think it's okay to be gay or transgender,
Yeah.
by talking about their child's identity, by asking them to help them understand what it's like for them, by affirming them in just very simple ways, makes a really powerful difference. And it
Yeah.
also opens up the family. I think what parents don't understand is that by strengthening their relationship with that child, they're strengthening the whole family. And
Yes.
and it makes and helping them think differently about what it really means now, especially during this time of such difficulty where we've lost family members, we've lost cultural leaders, people are suffering in so many different ways. Affirming a young person's identity changes the whole future for them, and it changes the
Yeah.
future for the family as well. So these are small steps that people can take, but they make a profound difference. And I
Yeah.
really hope that that folks will use these materials and put them out in a public space. We disseminate our family education booklets, but just putting those posters in public spaces can have, I think, a really important difference.
Yeah. One of the things that I've heard when you have adolescents, like I'm just going to say somebody 7 or 8 or 9 identify with their male to identify female, whatever. And some of the things that I heard is, oh, they don't know, they're young, their brain is undeveloped. How would they know? And this is just a phase and things like that. But that uh, most likely it's not the case. I always say that kids are some of the smartest people on the face of this earth because they're very innocent and very organic and they say what they feel. And so I think that's, I was doing some research on YouTube and all that when I knew we was going to talk about it. And that was one of the things that I came across. I said, oh, this is kind of interesting that this is the feedback that people are giving instead of just trying to understand and support and cultivate and things like that. So I want to ask you another question. So
Well,
when I was
could I respond to that for a sec?
yeah,
Which is
yeah,
that I think there are two things that are happening right now. One of the things that's happening is now we've actually had a lot of research. Believe it or not, people think we don't know much about gender identity. We've learned a lot about it since the first gender identity clinic for young people was started in the Netherlands in the late 1980s, and lots of research here in the US. And what people have found is that children have a sense of their gender identity typically by about age 3. So they know what gender looks like to them. They have a feeling for what it feels like for them. So that's one thing, that children learn about this very early as part of their development. But the other thing that's been happening, and it's been happening since the Second World War, when families had their lives changed dramatically. Typically in the US, when men went to war, women weren't typically doing that back then, although they served in lots of other ways. Women went into the factories. They changed how they dressed. They changed, so much about their lives. And we've had a really gender explosion since that time in terms of how people can present and in terms of increased awareness and understanding of transgender identities. But what's happened for young people is that it's not realistic to think that there's a highly feminine box that half the
mhm,
population fits in and a highly masculine box that the other half fits in. We go across the world, we see there are cultures where there are 5 gender identities and there's a lot of diversity. For young people, through time, having to fit into those boxes has been really hard. We see it most dramatically with transgender people who had to hide who they were for fear of not only their safety, but what would happen to them, that they wouldn't, be able to be connected to their families, that they would lose their homes, that they couldn't get a job. But as time has gone on, it's been so clear that as the rigidity about gender presentation has relaxed, all of those young people that suffered from anxiety and stress and mental health challenges because they had to try to fit into those boxes in order to be accepted and validated by their families. They don't want to do that anymore. And they see their peers being able to express gender in the way that feels right for them, in a way that feels comfortable and supported. And hiding is a mental health risk. Hiding is a serious mental health risk. We know that for all kinds of secrets that people keep. So as we go through time, we're going to be seeing more and more young people expressing their gender, regardless of what their sexual orientation is, in ways that feel comfortable for them and feel affirming for them, and that significantly decrease depression and anxiety and other mental health concerns. And this is something I think that as a society we have to contend with. And this is it's really important that we're seeing changes in public policy and policies in schools and other public spaces that support and affirm gender expression. That change is going to be more and more and more widespread as time goes on. It's not going to go back the other way. It's going to go forward. And it all is in the service of better mental health, more integrated lives, and happier, healthy people.
I definitely agree with you on that. You know, I have an acquaintance who maybe about 4 months ago, and he told me this by accident. He didn't. It was, trust me, the way the conversation was going, but he ended up joining the military at a very young age. And the reason why he joined the military was because he he started to like men, for lack of better terms, and he was scared to tell his family. And you know, he's Mexican too, and so, and I was like, oh, okay. And I kind of played along. I could tell he felt uncomfortable, and we've not talked about it since then. You know, but I felt like he wanted to. I felt like part of me felt like he told me by accident, and the other part of me felt like he wanted to just get that out, you know. And he was telling me about, then he started talking about how, you know, it's you know, you kind of got, like in the military, some people look down on it, but other people kind of accept it and around about it's just, you know. So it was a really interesting conversation, you know. So yeah, I do want to, I think we're running out of time. I want to, we are going to run out of time. We got like a minute left, but I want to do a part two to this. I'm gonna connect with you. We got to get together again and do a part two, because I really like the information that was shared. I love the presentation, the slides, and so I want to be able to, because I didn't even get to, as you can see, you know, I didn't get to all the questions. But I want to talk a little bit more about this too, because I know when I was reading about how COVID-19 affected the LGBTQ children and youth. I want to talk about all that. So we're going to connect again, and I want to find out what your availability is, and I want to do a part two to this, because I feel like this is definitely needed. I think it will serve as a good education tool for families who are struggling with loved ones that identify with the LGBTQ community. So, are you up for that?
Yeah, but I'm really busy right now, so
Okay.
we'll have to plan it for the future.
Okay. Okay. We'll definitely plan for the future. Okay, we've run out of time, Dr. Ryan, and thank you so much for being a guest on our
You're welcome.
show. All right. And that's it for today's edition of Mental Health Matter. If you like this particular show, if you would like to be a guest on our show, or if you would like a DVD copy of our show, please dial 916 366 4600. Thank you.